talking about the deaths that are caused due to the barotrauma. So the second section for this lecture basically comprises of the deaths that are caused due to the pressure changes in the atmosphere or in the environment. Now, these pressure changes can be caused due to the air pressures, or even they can be caused due to the water pressures in the environment. Now, whenever we are basically talking about decompression sickness, it can be caused even if a person basically mounts the high altitudes, or even it can be caused due to the deep sea diving phenomena. So this decompression sickness is discussed over here. Deaths are caused due to this decompression sickness, and we'll basically, the discussion will comprise of the deaths that were caused due to the barotrauma. What are the underlying causes that basically make the foundation for the fatalities in a particular case of barotrauma. That will be discussed over here in detail. So basically, scuba diving or deep sea diving, all of these are the major causes of this dysbarism, and that is basically defined over here in this section. So basically, whenever we are considering the different damages that are caused due to this dysbarism or due to this increased pressurized states, then we're basically considering the fact that it can be any due to the overstretching of the skin, it can be the injuries due to that phenomena, and even the middle ear can be involved in such traumatic conditions. And even it can be a situation which is known as a decompression sickness. The person can become unconscious and traumatized. So all of these conditions will be discussed over here. The definition of dysbarism, first of all. And starting off with the barotrauma in particular, the discussion goes on, and we'll be discussing the physical damage that occurs after a person goes into a state when there are high pressures implemented on him or her from the atmosphere, whether it is the air pressures or the pressures due to the water in the surrounding areas. So the Dysbaric fatalities and the barotrauma, diving is one of the leading causes that can basically occur to be the foundation of the barotrauma and the deaths due to the barotrauma. So basically what happens is impact of the environmental condition is the mainstay over here. It can be a water pressure or it can be an air pressure if we are mounting a high altitude. The individual characteristics are basically taken into account in a particular situation. If we are talking about the diving phenomena, we'll even note down the temperatures of the water, whether it was the sea water or whether it was the fresh water that we're talking about right now, and we'll just write down it during the autopsy report, the crime scene investigation, as already emphasized in any other crime investigation or in any other death. The crime scene has to be basically visited by the forensic practitioners and the forensic experts, and all of the environmental conditions have to be noted down in detail over here. So the concomitant morbidity, as we are considering a normal individual, so we can also consider if there is some pre-existing disease in a particular individual, or if the person was suffering from some sort of a physical disability, that has to be noted down in detail that this was a pre-existing condition in a particular case, in a particular person, and he was exposed to a particular environment in which he basically faced trauma that led to the death of the person. So that is the mainstay over here. Equipment malfunction or poisoning, if it is suspected in a particular case. Sometimes it is the case of the post-mortem drowning phenomena. So one has to look for the signs of the post-mortem drowning, and in the relevant section we have discussed basically the signs and symptoms of the post-mortem drowning and how it has to be distinguished from the ante-mortem drowning phenomena. And will also basically take into account the potential hazards of the environment as well. It can be any predators in the environment, and any predators in a particular locality or in a particular seawater or in a particular fresh water that can be taken into account whenever we are considering deaths that were considered to be due to the drowning, due to the diving phenomena. The dysbaric fatalities and the barotrauma, the pathophysiology behind it is basically the rapid depression and the bubble formation. So this basically happens when there is a rapid depression after you dive into whatever temperatures of the water it is. But whenever you dive, it is a rapid depression phenomena. The oxygen levels basically fall and a bubble formation basically starts off. Moving on, basically there is a venous stasis that occurs. And after that, it can basically obstruct the vessels. So that is one of the causes over here. And it can also lead to the ischemic injuries in a particular case. Because in such a case, whenever the vessels are obstructed in a particular case, it is basically going to slow down the blood flow even to the brain, even to the heart. So the vital organs are going to be affected, and that is going to prove ischemic, and the ischemic injury is going to occur to the cardiac muscle and as well as to the brain tissues. So this can prove to be fatal in this condition, and injured endothelium is seen whenever you basically send the cardiac tissue or the brain tissue or the other organs, for example, the kidneys, the liver, the spleen is sent to the histopathologist, and he's going to report that there is injured endothelium observed in these vital organs. So basically there is a hyperbaric exposure. What basically happens is there are different chambers and the person or the patient is put in these hyperbaric chambers. So this is one of the reasons. And then we have the hypobaric exposure. Depending upon the case that we are treating, it can be a hyperbaric or it can be a hypobaric exposure, and we're going to treat the case accordingly. So the physical damage is again very important over here, and the effects of this particular physical damage that is to be discussed over here are basically it can be the paranasal sinuses. So we can see the signs of inflammation or we can see the signs of infection in a particular case of the barotrauma, and even these paranasal sinuses, the endothelium is affected of these paranasal sinuses. That can involve the maxillary sinuses, and it can also involve the frontal sinuses or the ethmoidal sinuses as well. Moving on, it can be damage to the teeth as well due to the pressure and due to the overstretching phenomena. The teeth, they have to be looked for. Even it can be a complete avulsion. It can be a damage to the gums as well. So all of this has to be documented in the autopsy report. What are the findings of the physical damage that occurred due to the barotrauma? Middle ear is affected the most because of the tympanic membrane that basically is quite sensitive to the pressures in the environment. So it can be affected, and the middle ear infections are found in this case, and even the tympanic membrane is ruptured in a lot of cases. Then the thorax has to be examined in detail, and one has to look for signs of pneumothorax or even the signs of pleural effusion. So the alveolar walls are ruptured in such a case, and the interstitial emphysema is looked for in a particular case. The lungs have to be basically sent to the histopathologist, and bullas have to be seen in a particular case of interstitial emphysema. Pneumothorax, that is air in the thoracic cavity, is again one of the features of the barotrauma, and that has to be looked for. So in this section, basically, we give an overview of the barotrauma. How do you define dysbarism, and what are the basically physical causes that are physical damage that is caused due to the dysbarism phenomena that is discussed over here. So that is the end of this section. Thank you for watching sqadia.com.